in the evening.
Hello, this is Dr. Heidi Horsley, Executive Director for the Open to Hope Foundation and host of the Open to Hope radio show. And I'm here today with Helen Chapple, anthropologist and a nurse, and we are going to be talking about dying patients' rights. Helen, what inspired you to write the book, No Place for Dying, Hospitals and the Ideology of Rescue?
I was very interested as a nurse at the bedside in how it was that dying wasn't happening very well in the hospital. I have hospice experience as well. It's sort of been a quest for me to wonder about how it is that more people don't find hospice and why it is that dying patients are not very well served in the hospital.
You say that dying people became second-class citizens in the hospital. How does that manifest itself?
The first-class citizens in the hospital are the ones who are eligible for rescue.
Okay.
They're the ones who are going to be getting CPR. And as you know, CPR is the default mode for most hospitals. In the course of a serious illness in the hospital, what's happening is that we're trying our best to keep them going. We're throwing all of our interventions at them, and perhaps they're just not looking like they're going to survive. So when they cross over that sort of threshold and we make them into a dying patient as opposed to a patient, they become a dying patient, then they become a second-class citizen in a hospital because they're no longer eligible for that first-class rescue care.
Talk about our cultural belief in rescue technology and infinite possibilities.
Well, that's sort of our belief that as the United States considers itself exceptional, we can overcome any adversity because we are who we are, and that's our job. And we can use technology because we're an innovative culture, and that's what we do. So what we do for people is sort of our only universal health care is if you collapse, we will pour everything into it.
Okay, and so if a loved one is dying in a hospital and I believe they're being treated as a second-class citizen, what can I do?
You can advocate for them. If there is palliative care available, or if there's that kind of consultation available, if your loved one is on that sort of path, the team and you have made that decision, you need to ask for that. You need to ask for palliative care, and if you see that your loved one is in any kind of distress, the clinicians need to be addressing that and addressing it aggressively, whether we're trying to cure or not.
Okay, very good, Helen. This is so important. Thank you so much.
Against my nose I smile, and I suppose that somehow maybe you are there when I'm dreaming and I find myself awake without a warning. Then I rub my eyes and fantasize, and all at once I realize it's morning.